Hi everyone, Amber Canoy here with Everyday Kentucky. Thanks for joining us for a journey around the bluegrass where we're adding life to your years. And DG, you have brought us to Commonwealth Smiles today.
Yes. We're here at Commonwealth Smiles because it's important to focus on our oral health as we get older.
DG has brought us back to Commonwealth Smiles. Dr. Jessica Kress is with us. We're talking about those silver fillings as we age. Those are probably something we need to look at getting, replaced.
Yes, for several reasons. So first of all, Amber, nobody likes the way they look.
Right.
But that's not even what I'm going to talk about. Do you realize metal fillings are placed directly into a tooth and they're not actually connected or bonded to that tooth?
What?
So the minute they're put in, they're not sealed. So years go by, things are leaking. Can you imagine what's in your mouth getting down in there? Not good, not pretty. So not only do we have risk of decay, but those metal fillings are actually harder than your tooth. Little trivia, enamel's the hardest thing in your body, and metal's harder than that. So it cracks the tooth around the metal. So I see all the time these little spider web patterns. I use digital photography in my office and I show the patient up on the screen and they're like, that is my mouth, get it out. And so we do. We spend a lot of time replacing metal fillings with white fillings and it makes them look better, so that's good too. It's an added bonus.
You make me want to go check my mouth in the mirror right now. I'm not even joking.
Let's
Make
go.
sure I don't have any.
Right.
That sounds horrible. And I know that if things are being able to get into the tooth, our overall oral health affects our heart health, everything.
There's all kinds of issues. And then the next thing I'm going to recommend to a patient is to wear a night splint or a occlusal guard, there's different names for these, to protect the teeth from flexing, because our teeth flex, that's a normal thing. And so when I get rid of the hard material and replace it with a white filling that is more compatible with tooth structure, that's first of all very important, and then we cover it with a night guard. So check us out at Commonwealth Smiles. I have all kinds of tips for you, Amber.
All right, wkyt.com/journey.
Add life to years. A journey around the bluegrass is brought to you by Aging with Grace.